Okay, so let's proceed with the 262. Which hydroxide is not amphoteric? That is your manganese hydroxide. So what is amphoteric? Amphoteric is the capability to react with both acids and bases. So your aluminum hydroxide, your zinc hydroxide, your chromium hydroxide are able to react both acids and bases. So they are amphoteric in property. So the exception here is your manganese hydroxide. Letter D. 263, which of the following is not yellow? So the answer here is your silver chromate. Silver chromate because it is red in color. So your cadmium sulfide, your silver phosphate, and your silver arsenate is yellow in color. So I repeat, your cadmium sulfide, your silver phosphate, and your silver and arsenate is yellow. Yes, yellow in color, sorry. And then your letter B, your silver chromate is red in color. Number 264, Nessler's reagent is used to identify ammonia. So Nessler's reagent is used to detect small concentrations of ammonia. So a yellow coloration indicates the presence of ammonia, and at high concentrations, a brown precipitate may form. So, kapag small concentration, yellow yung coloration niya, and then at high concentration, brown yung precipitate na nagfo-form. Number 265, it is used in the treatment of cystitis with methenamine, that is your sodium biphosphate. So, sodium biphosphate plus methenamine is used for the treatment of cystitis, and it is administered internally to produce distinctly acid urine. Ayan. 266, prolonged use of silver nitrate may lead to undesirable discoloration of the skin, which is known as your argyria. This is due to the deposition of free silver in the skin. So, the prolonged use of silver nitrate will lead to the discoloration of your skin, which is known as your argyria, due to the deposition of free silver in the skin. 267, this ion produces violet color to the non-luminous flame, that is again your potassium. Ulitin natin, calcium is brick red, sodium is persistent golden yellow, potassium is violet. Ayan, na-memorize ko na yung non-luminous flame ninyo. 268, radioisotopes can be produced from the following except X-ray machine. So, radioisotopes can be produced from nuclear pile, cyclotron, and your radioisotope cow. So, the exception here is your X-ray machine. Letter C. 269. The radiopharmaceutical which is used as a diagnostic aid to determine blood plasma volume and cardiac output is your iodine-131 serum albumin. So, iodine-131 serum albumin is used as a diagnostic aid in determining blood plasma volume and cardiac output. 270. Which of the following salts has a pH greater than 7? That is your calcium, Ano to? Wait. CaC2O4. What is that? Greater than 7. That is your CaC2O4. Kindly check the chemical name of your CaC2O4. Okay? 271. Oxidation is a half reaction that involves a loss of electron. So, kapag oxidation, automatically, there is a loss of electron. Kapag reaction naman ay reduction, there is the gain of electrons. Okay, the ionization constant of the strongest acid is Ha, Ka 7.2 times 10 to negative power. So, Ha has the highest value of the dissociation constant, which suggests that it is the strongest acid among the choices. Okay, 273. Used for kidney imaging or determining renal function. That is your technetium 99 heptagluconate. From the term hepta, meaning it is related to your renal function. 274. The following oxides are acidic with water except your ferric oxide, which is basic with water. So, your fluorine oxide, your nitrogen oxide, and your sulfuric oxide are acidic with water. So, the exception here is your ferric oxide. 275. A mixture containing 30% of zinc sulfide and 70% of barium sulfide is known as lithopone. Letter D, lithopone. It is a white pigment composed of barium sulfate and zinc sulfide. So, it is a mixture of 28 to 30% barium sulfate and zinc sulfide 68 to 70%. Parang baliktad ata yung sa question. Basta lithophone. The answer here is lithophone. So, it is used as a filler in paper, leather, and linoleum. It is used as a filler in paper, leather, and linoleum. Okay, 276. Antimony in the presence of hydrochloric acid gives a violet precipitate with this pink dye, which is your rhodamine B. So, rhodamine B will give a violet precipitate in the reaction of antimony plus hydrochloric acid. So, that is letter D. 277. Method of sterilizing sodium bicarbonate for parenteral use. The answer is all of the above. So, you're autoclaving, you're heating in an open vessel, and resaturating with sterile carbon dioxide. Bacteriological filtration are the methods of sterilizing sodium bicarbonate for parenteral use. (278) The following are non-systemic antacids except your sodium bicarbonate. Because it is, your sodium bicarbonate is a systemic alkalinizer and antacid. Systemic antacid. While your aluminum hydroxide, your dihydroxy aluminum sodium carbonate, and your calcium carbonate are non-systemic antacids, while your sodium bicarbonate is a systemic antacid and a systemic alkalinizer. 279. So, ammonium chloride is contraindicated in patients with impaired hepatic function. So, ammonium chloride is contraindicated in patients with impaired hepatic function, letter C. 280, the radiopharmaceutical use for the hepatobiliary studies, that is your letter D, technetium-99m HIDA. Technetium-99m HIDA, letter D. While technetium-99 heptagluconate, your technetium-99 heptagluconate is used in determining your renal function. While your TC99M HIDA is used for hepatobiliary studies. Letter D. 281, the indicator used for USP limit test for arsenic is your silver diethyl dithiocarbamate. Silver diethyl dithiocarbonate. That is the indicator used for the limit test for arsenic. 282, povidone iodine. A water-soluble, non-toxic, non-staining, and slow-releasing antiseptic is a complex of iodine with polyvinyl pyrrolidone. So, polyvinyl pyrrolidone plus your complex of iodine will provide your povidone iodine or your betadine. It is used as an antiseptic. Okay. 283. Zinc deficiency characterized by thickened, scaly, inflamed skin is known as your parakeratosis. So, it is a metabolic disturbance resulting from a deficiency of zinc or inadequate absorption of your zinc due to excess of calcium and other chelating agents. So, the primary symptom of your zinc deficiency is your thickened, scaly, inflamed skin, which is your parakeratosis. So, i-connect nyo na lang yung zinc deficiency is that of the parakeratosis. 284, primary bicarbonate excess. Metabolic alkalosis. So, bicarbonate is a systemic antacid and anti-alkalinizer, and excess of it can bring metabolic alkalosis. So, the excess or the increased presence of your bicarbonate will result to a metabolic alkalosis. 285, dehydration and decreased renal blood flow are conditions of your hyperchloremia. So, hyperchloremia is also associated with that of your hypernatremia. And then the result is dehydration and decreased renal blood flow. Take note, your chloride is the most abundant anion in the extracellular fluid. Your chloride is the most abundant anion in the extracellular fluid. 286, the following are respiratory stimulant except your soda lime because it is a carbon dioxide absorber. So, soda lime is a mixture of calcium hydroxide and sodium or potassium hydroxide, which is used in anesthesia and oxygen therapy, and its function is to absorb carbon dioxide which is otherwise would accumulate in the system. So, your carbon dioxide, your ammonium carbonate, and your aromatic ammonia spirit are respiratory stimulants. So, the exception here is your soda lime. 287, anemia due to decreased blood formation can be caused by deficiencies of key materials, cobalamin, folic acid, and pyridoxine. So, your Cobalamin is your vitamin. B12, your folic acid is your B9, and your pyridoxine is your B6. So, anemia is due to the decreased blood formation, can be caused by deficiencies of your vitamin B complex. So, your vitamin B6 is your pyridoxine, your B9 is your folic acid, and your B12 is your cobalamin. 288, use as wet dressing for persons suffering from third-degree burns. That is your potassium permanganate. So, potassium permanganates are primarily used as wet dressings for persons suffering from third-degree burns. 289, a dentifrice which contains formalin and reduces the sensitivity of teeth to heat and cold is your Thermodent. Thermodent. Ayan. Your Thermodent contains formalin and it is used as a dentifrice. Okay. 290, a halogen characterized as a dark reddish brown fuming liquid with suffocating odor is your bromine. So, it may be recognized by its characteristic unpleasant odor, and it imparts a yellow color to starch test solution. And when it is combined with carbon disulfide, it will result to a reddish yellow color. Ayan, kapag suffocating odor, that is already your bromine. 291, tartar emetic, known to be an effective anti-schistosomal agent, that is your letter B, which is your antimony potassium tartrate. Antimony potassium tartrate. So, it is used in the treatment of anti-schistosomal or for the treatment of schistosomiasis. 292, use of sodium bisulfite. It is used as antioxidant. Sodium bisulfites and other bisulfites are used as generally as antioxidant. Slaked lime. Your slaked lime is your calcium hydroxide. So, slaked lime is your calcium hydroxide. So, the use of your slaked lime, it is used as an antacid. Your calcium oxide here is known as your quicklime. Your calcium sulfate is your plaster of Paris, and your calcium carbonate is your limestone. So, I repeat, your calcium hydroxide is your slaked lime, your calcium oxide is your quicklime, your calcium sulfate is your plaster of Paris, and your calcium carbonate is your limestone. Okay, and the use of calcium hydroxide generally is antacid. 294, mechanism of antibacterial action of potassium permanganate solution is oxidation. So, permanganates function exclusively as oxidizing agent and they are the best ones used in therapy. So, they are the number 1 oxidizing agents, permanganates, such as your potassium permanganate. 295, he discovered oxygen and called it imperial air, letter C. Skill. Si Priestley naman, he discovered oxygen and called it dephlogisticated air. Si Becquerel naman, he discovered uranium, and si Cavendish, he discovered hydrogen and called it as an inflammable air. So, si Cavendish is si hydrogen, si Scheele is si imperial air, si Becquerel is si uranium, si Priestley is the phlogisticated air. 296, magnesium ammonium phosphate is the only white phosphate. So magnesium ammonium phosphate is the only white phosphate. 297, white precipitate is also known as your ammoniated mercury. White precipitate is also known as your ammoniated mercury, which contains not less than 98% of your mercuric ammonium chloride. Contains not less than 98% of your mercuric ammonium chloride, and it is used as a dusting powder against eczema and parasitic skin diseases, and has useful effect against low-grade staphylococcus infection. Your calomel is also known as your mercurous chloride. Your calcium oxide is known as your quicklime, and your zinc sulfide is known as your sphalerite. Sphalerite, quicklime, and mercurous chloride. 298, it acts as antacid in small doses and as laxative in large doses. That is your magnesium. So, magnesium, so in small doses, it is used as antacid, and in large doses, it is used as laxative. 299, this compound is used as carbon dioxide absorber. Chassis, soda, lime. What is your soda lime again? Sino na yung calcium absorber? Carbon dioxide. That is soda lime. Mixture of your calcium hydroxide and sodium or potassium hydroxide. Your soda lime is a mixture of calcium hydroxide and sodium or potassium hydroxide. Okay. And last, the Regia pharmaceutical that is used for kidney imaging or determining renal function. Again, your technetium 99M hepatogluconate. So, that is the end of your inorganic pharmaceutical chemistry. So, our next topic would be your organic pharmaceutical chemistry.